Hi, I'm Dave Wurzel, and you're watching PHTV4 Living Well. And on Living Well, we take a look at a variety of topics related to living a healthy lifestyle, whether it's nutrition, exercise, or some type of care of ourselves. Today, we're going to take a look at dealing with your back and keeping your back healthy, or if you're feeling pain, maybe how to get healthy. With me to take a look at this topic is Dr. Ryan Gorin, chiropractor. Dr. Gorin, thank you for being here today.
Thanks for having me.
All right, so can I call you Dr. Ryan?
Yeah.
Okay. The first thing I want to talk about is I think when we think about going to a chiropractor, we're immediately thinking, or for me anyway, like, oh, I'm in pain, I better go see somebody. But we want to kind of take a look at how do we also avoid even getting to that situation. So maybe the first thing I'd like to take a look at are what are some things just before we get to the pain, just on a day-to-day basis, part of our normal lifestyle that we can be doing or should be doing to help avoid creating back pain or back problems?
Yeah, so for me, one of the best preventatives is consistent strength training. So if you have access to a gym or even at your house with a little bit of equipment, keeping your spine and your core very stable and in control is by far the best way to stay pain-free with your back.
Okay, now it's interesting because I'm thinking, I love that advice and I'm trying to follow that advice myself. What if the person is out there and they're like, well, I don't know what exercises to do to strengthen my core or protect my back? Because there are exercises or things they can do probably if they did them wrong or did too much of a certain thing or the wrong thing, they probably could aggravate it still, right?
Absolutely.
So what advice would you give about the types of exercises to do?
So we want to focus on the exercises that we perform in our everyday life. So a lot of people get nervous with the word deadlifting or squat because, yes, if you do it incorrectly, you could actually harm your back, even though you're doing something as great as exercising for yourself. So what we really emphasize is making sure that you either study the movement yourself or ask professionals like myself on proper form and technique. But the exercises that we do when you think about it every day is we pick things up from the ground. That's your deadlift. We sit in and out of chairs. That's your squat. So we like to train these movements and strengthen these movements to make not only our everyday life easier, but it's also one of the best ways to prevent back pain at the same time.
You know, and the thing that I find interesting related to that is that the movements, just as you're saying, they're part of our normal thing. Like deadlift, I think people think of like, bodybuilders or Olympic lifters or things like that. But people can do deadlifts without weight or with very, very light weight, or they can do squats without weight or very, very light weight and still develop the muscles you're talking about, right?
Absolutely. And the thing too is once we lose the ability to do those movements, we're actually in even more trouble. So when you have pain going into and out of a chair, you're going to start to lose mobility and range of motion. And as we know, the less we move in life, the more prone we are to pain and discomfort. So yes, for one, you can easily bring the weight down and kind of, have the proper progressions to load it up with, making sure that the form is right.
And it does sound like that would be a really good situation to work with a professional trainer to kind of help you to maintain the technique. And I'm very much aware as a coach myself, if an athlete breaks technique, they're putting themselves at increased risk of injury. Instead of getting the benefit of the thing, there's a chance they're going to hurt themselves in the process. How about the other part of it I want to ask about? I know you work in this area. We talked about developing the strength. Flexibility, nutrition, oddly enough, can help protect your back also. How do those two get involved in this?
Yeah, so once we lose range of motion, we are prone for compensation elsewhere. So let's say our hips are not moving right. That can easily lead to unnecessary movement in our low back or vice versa. So we want to make sure that our mobility, and we have specific guidelines on, hip joint, back joints, shoulder joints that you want to maintain throughout your life. And once you go below certain numbers, you are more prone to having pain, whether it's your back or other joints in the body. And when it comes to nutrition, a lot of people think arthritis is from poor movements or just a lot of movement throughout your life. It's usually from inflammation over years and years or decades of eating poorly. So if you ever look into an anti-inflammatory diet, and there's several out there, there's no blueprint just for each individual. There's a lot of different varieties out there. That is typically, in terms of changing arthritis, one of the best ways is nutrition.
How, then if we can kind of piggyback onto that, so adjust your diet. That'll also help this. And we're also, maybe to clarify, we're not talking about like all of a sudden you get the quick fix. We're talking about it like a lifestyle changer, right?
Yes, absolutely. Everything does come full circle. So typically you're going to feel how you're eating. So if you're eating well, you're going to feel well, you're going to reduce inflammation, and vice versa. I'll even notice with myself, if I eat poorly over a weekend, whether that's like acne or you're breaking out, sometimes you'll have brain fog. So sometimes you can get a gauge on just how your body is feeling, whether it's little aches and pains, whether it's brain fog, breaking out with your skin. It's typically a sign on how well or unwell your nutrition is.
Right. And obviously even how well you recover. Are you putting the right things in your body so that your muscles can respond and recover the way they need to? And then I guess I'm going to throw out another component because I was surprised at what a big difference this could make. Even certain shoes. Wearing the right type of shoe, the shoe that fits right for how you walk or the type of activity you're engaged in, right? How does that fit into this?
So with shoes, a lot of it depends on the arch health. So there's people that have high arches, there's people that have flat feet. It also depends on the activity that you're performing. When we do more of our strength-based workouts, a lot of people wear different shoes versus cardio-based workouts. So if there's a lot of high impact, that's a point where you want a little bit more cushion just to protect your joints to absorb some of the shock. When it comes to some of our strength exercises, we want to actually feel the ground a lot more. So more of like a minimal shoe is more recommended. But it also depends on the arch health as well. It can get complicated when it comes to that, whether you should be wearing orthotics or not. But yeah, sometimes digging into that can help with performance and injury prevention.
And it's interesting because we're talking about so many different things to keep the back healthy, to keep the spine healthy. But if you do all these things, you really decrease the risk of, not that you can prevent it completely from, getting injured or getting hurt in some way, but you can hopefully extend the life of it and decrease the risk of it, would you say?
Yeah, absolutely. So posture and taking the preventative lifestyle with consistent movement, and it doesn't have to be heavy strength, but just some form of exercise, it does make a gigantic difference with preventing back pain.
So that was going to be my next question. Thank you very much. What are regular, like let's say not going to the gym, regular exercises, regular movements people can do that are healthy and part of addressing some of the things that we're talking about?
Mm-hmm. Well, I think just to peel it back, just movement is good for our bodies. And it's not just for our backs, it's for any joints. So what we're doing now, we'll have to take a walk after this interview, is get out of this static position. And so, long desk jobs, even some of these standing desks, they're, in my opinion, better than, sitting down all day. But standing without movement is also not the best for our spines as well, or any of our joints. So movement is just the number one way to break tension, break pain away. But, if it's not at a gym, just, getting outside, walking, going to the park, hiking, just anything that's very simple, getting outside, getting sunlight, it can, kind of break that constant tension that we're in when we're not moving like we are right now.
I like that also, so we don't have to go to the gym and do the heavy work. We don't have to necessarily go see a professional trainer, even though in certain situations it definitely would be a benefit. But the idea that, how about just go for a walk? How about just don't sit as much? I know recently I read an article about how bad sitting can be for us. Sitting is actually maybe more detrimental to our back than a lot of other things we do, just because we do it so much. Can you speak to that a little bit? Or?
Yeah, I mean, usually when I'm seeing patients here, it's two main categories. It's those that are sitting a lot with desk jobs, and it's those that are just moving improperly. So going back to our discussion on like deadlifting and squatting, we call it hip hinging, when we're training people, just the ability to load your spine the right way and making sure that you're in proper alignments, going all the way down, all the way up. So if you are, blue collar, somebody that's very active with their work, and you're moving improperly for 8 hours a day, you're going to be more prone to those aches and pains too.
So a lot of areas to touch on there. Your office is kind of interesting. I think we need to touch on this a little bit because we're in a very, I'd say, traditional clinical type office now. But you specifically, and I think this needs to be part of it, there are a variety of ways to treat injuries related to the back or help people recover. What are some of the methods like you offer here that are a little bit non-traditional, would you say? I don't know if that...
Yeah, so in 2019, we expanded our business into a hybrid business. So you started off as a chiropractic physician, started in 2014, and then in 2019, we doubled our square footage and started group fitness training here and personal training. And it really has so much to do with how I treat patients with back pain. So, I'm not the type of chiropractor that, just adjusts you. I'll see it 3 times a week for the next however many months. We get very hands-on. We teach you how to move. We rehab. And we're making sure that you understand how this will never happen again. That's one of our main goals, is the education component. And then, if they are interested in our approach, we have the group fitness side. And we also have a lot of people that will join our group fitness classes with pain, never have seen me on the chiropractic side, that will have no pain within a few weeks. Because, for one, they're moving constantly. We are very strict with form and technique. And when you do that over a couple weeks, people are amazed on how good their bodies can feel fairly quickly.
I was going to say, that's got to be rewarding, especially because I would think people at that point feel like this is a long-term way to a healthy back. Not like I take a pill, make the pain go away, but the pain might come back, or I'm going to do something. No, I've learned how to live to keep my back this way, right?
Absolutely. And that's what we try to do, too, is we try to be as educational as possible. So we don't expect all of our clients to work out here forever. So if they do ever leave, whether it's out of state or just moving to another gym, we want them to understand how to exercise without us eventually. That's a big component as well.
Okay. So a lot of good advice here that I kind of want to make sure that that people, this is a comprehensive thing we're talking about, right? A holistic approach. We're talking about diet and exercise, and then if we're going to do something a little bit more aggressive in the types of exercises we do, and then the how-to part, I guess, right? And then also, obviously, it can matter, how much time we do certain activities, what types of shoes. I mean, there's a lot of areas here for people to touch on. Maybe can you ask or answer, is there, what advice would you give just to, do the elevator pitch advice for, hey, they want to avoid that, or they can even feel that twinge in their back now. What should they do first, or what's the next step?
If they're in back pain, you're saying?
Yeah, minor pain, or they can, or they're trying to avoid getting there.
Gotcha. So we do typically recommend setting up an appointment, and not necessarily chiropractic. It could be with a physical therapist. And you want to get evaluated because pain is not random. There's always a reason for pain, and that could be lack of range of motion. That could be, an unstable, core or spine. There's many reasons, but with a thorough examination, we can start digging into the answers on the why. And once you figure out the why, the treatment becomes a lot easier at that point.
Right, and that makes sense too. Like, if I feel pain, my body's trying to tell me something.
Exactly.
And then let's try and respond to it in the right way. Okay, good. Do you have any other advice you want to throw out for people in this area?
Yeah, it's just eat well, move well, sleep well. It sounds simple. It's very hard to do, believe it or not. I'm trying to improve myself every day with it. But the combination of those 3, you're going to feel great. Typically, pain will decrease, and you're going to be able to move well, hopefully long into your life.
That sounds, and you're talking about lifestyle change, and also probably some patience, because they're going to have to move through that to get into that routine. Dr. Gorin, thank you very much. It's been incredibly helpful. This is good information. It seems like back pain is something a lot of people deal with at different points in their life, so thank you.
Thank you for having me. Appreciate it.
I'm Dave Wurzel, and you've been watching Living Well on Peach TV4. We've been at Primal Chiropractic on Harlem Avenue in Palos Heights, talking with Dr. Ryan Gorin. Thank you for watching, and be healthy.